Morning class. So today we're going to be going over chapter 14, medical overview. So this just has to do with a lot of your patient assessment. So medicine applies fundamental knowledge to provide basic emergency care and transportation based on assessment findings for an acutely ill patient. Medical overview, assessment management of a medical complaint. So how do you assess the patient? Once you find out their medical complaint, how do you manage the patient? Where do you go from there once you figure out what the problem is? Pathophysiology, assessment and management of medical complaints to include transport mode, destination decisions. So transport mode means either you're going to go code 2, no lights and sirens to the hospital, or code 3, lights and sirens. It's going to be an emergent transport. And the destination decisions, which hospital are you going to take the patient to? Is it going to be a stroke center? Is it going to be a heart attack center, or a STEMI center, or a trauma hospital? Infectious diseases, awareness of a patient who may have an infectious disease. So this is why it's very important to do PPE on every call. We don't know what patients have, and patients may not be entirely truthful with us. So this is why it's always important to wear PPE on every call. Assessment and management of a patient who may have an infectious disease. Patients who need EMS assistance generally have experienced a medical emergency, a trauma emergency, or both. Trauma emergencies involve injuries resulting from physical forces applied to the body, such as a car accident, an assault, things of those natures. Medical emergencies involve illnesses or conditions caused by disease. So somebody with CHF or COPD is considered a medical emergency caused by one of those diseases. So types of medical emergencies. Respiratory emergencies, patients have trouble breathing or the amount of oxygen supplied to the tissues is inadequate. So such as COPD, that's a respiratory emergency, or asthma. Cardiovascular emergencies caused by conditions affecting the circulatory system. Neurological emergencies involve the brain, such as a stroke or TIA. Gastrointestinal conditions, appendicitis, diverticulitis, pancreatitis, and many others. So what does itis mean at the end of a medical term? So anything with itis means inflammation of. So inflammation of the appendix, inflammation of the pancreas. Those are gastrointestinal conditions. Urologic emergency, kidney stones. Endocrine emergencies, most commonly caused by complications of diabetes mellitus. So remember the abbreviation diabetes is DM, diabetes mellitus. Hematological emergencies may be the result of sickle cell disease or blood clotting disorders. Immunological emergencies involve the body's response to foreign substances. Toxicological emergencies include poisoning and substance abuse. Gynecological emergencies involve female reproductive organs, such as pregnancy. Some medical emergencies are caused by physiological or behavioral problems, may be especially difficult to deal with because patients do not present with typical signs and symptoms. So this is why it's important to have a good patient assessment on every patient. Don't get tunnel vision. Make sure you rule out all the causes before you start just narrowing in on, it might be a psychological or behavioral problem. They might be a diabetic. Their sugar might be low. They may be combative because their sugar's low. So in this little table on your common medical emergencies, respiratory, you have asthma, emphysema, chronic bronchitis, cardiovascular, heart attack, CHF, neurologic, seizure, stroke, syncope, gastrointestinal, urologic, endocrine, hematologic, and so on. Okay. So that's a good table to look at. Similar to the assessment of the trauma patient, but with a different focus. Focus on nature of illness, symptoms, and chief complaint. So establish an accurate medical history. Use dispatch information to guide initial response. Yes, it's important to know which call you're going into and you kind of prepare yourself, But always be aware that just because the call comes in as one thing, it might be something completely different when you walk in the door. And don't be blindsided by that. And this is, do not get locked into a preconceived idea of the patient's condition. So that's why it's very important to, if you have somebody who's complaining of abdominal pain, they might actually have chest pain. Instead of going down the abdominal route, you might be going down to chest pain, maybe it's cardiac. Injuries may distract from the underlying condition. Assessment may be difficult with uncooperative or hostile patients. Maintain a professional, calm, non-judgmental demeanor. Refrain from labeling patients. A frequent caller may have a different complaint this time. So treat every patient like you haven't been on them before. Do a full assessment. Make sure you don't miss anything, because that's how patients get injured. So scene safety. Make sure the scene is safe. Use standard precautions. Determine the number of patients and whether you need additional help or additional resources. Do you need PD? Do you need fire? Do you need another ambulance for multiple patients? Nature of illness. Determine the nature of illness. Okay. Figure out what's going on. Figure out what they're complaining of. Index of suspicion. Your awareness of potentially serious underlying injuries or illness. So basically what this means is, especially in trauma, you expect certain types of injuries for certain types of traumatic events. So on a car crash, when somebody's rear-ended, their head's going to snap back. So they're probably going to complain of neck pain. Or if the steering wheel is deformed, they're probably going to hit their chest. So have your index of suspicion. So develop a general impression. Perform a rapid examination of the patient. Visual clues include apparent unconsciousness, obvious severe bleeding, and extreme difficulty breathing. Quickly determine the patient's level of consciousness. So this is what I talk about when you guys come on scene. As soon as you come on scene and you see the patient, look at how they're presenting. Are they awake? Are they conscious? Are they having difficulty breathing? Is there oxygen tubes around them? Is there oxygen tanks on scene? Is the scene safe? You're always looking. Airway and breathing. Unconscious patients, ensure the airway is open and they are breathing adequately. Check respiratory rate, depth, and quality. So how fast are they breathing? Are they getting good tidal volume? What's the quality of it? Is it rapid? Is it shallow? Is it regular? Is it irregular? Consider applying oxygen if breathing has been affected. For unconscious patients, make sure to open the airway using the proper technique. So if you think it's a medical, how are we going to open the patient's airway? Okay, so head tilt, chin lift. Or if it's a trauma, we're going to do jaw thrust. So apply oxygen to patients in shock with difficulty breathing and when low oxygen saturations are measured. So anything below 94%, we're probably going to give oxygen to a patient. Unconscious patients may need airway adjuncts and ventilatory assistance with a BVM or bag valve mask. Okay, circulation. Assess a conscious patient by checking the radial pulse and observing the patient's skin color, temperature, and condition. For unconscious patients, assess at the carotid artery. So when you're coming on scene, you're talking to a patient, you're asking them what's wrong, you introduce yourself. You could check circulation. You could check airway and breathing all at the same time. And while you're feeling for a radial pulse, you can feel their skin. Does it feel warm? Does it feel cold? Does it look cyanotic? Does it look pale? Is it diaphoretic? You're looking at all those things. Okay, transport decision. Patients in need of rapid transport, unconscious or have an altered mental status. Airway or breathing problems. Obvious circulation problems such as severe bleeding or signs of shock. So, patients in need of rapid transport are going to be going code 3 to the hospital, lights and sirens. Okay, history taken. Determine what the problem is or what may be causing the problem. Gather a thorough history from the patient, any family, friends, or bystanders. For an unconscious patient, survey the scene for medication containers or medical devices. So, you always want to ask the patient, what what their medical issues are or what their medical history is. Sometimes patients will tell you that they have great medical history, and then you ask them if they're taking any medication, and there's 15 medications that they're taking. They think just because they're taking the medications, they don't have hypertension anymore, or they don't have seizures, or they don't have diabetes anymore. But that's why it's important to always ask medications. Most medications are probably going to be in the bathroom. So that's a good place to look as well, or patient's nightstand. So obtain a sample history and use the OPQRST mnemonic, recording the allergies, medical conditions, and medication. So what's a mnemonic I told you guys to always use on a patient? That's HAM, history, allergies, and medications. Some patients take numerous medications and take the medications with you to the hospital. A lot of the times when patients hand me more than 7 or 8 medications, I just bring them all to the hospital. I put them in a Ziploc bag and I throw them on the back of the gurney with me. So tacos, tobacco, alcohol, caffeine, over-the-counter medications, herbal supplements, sexual and street drugs. Scan the scene for clues about the patient's medical history. So you could always look around. Are there empty beer bottles around? Is there empty liquor bottles around? Is there empty medication bottles around? Secondary assessment may occur on scene or en route to the ED. In some cases, you may not have time. Physical examination. All conscious patients should undergo a limited or detailed physical examination. For unconscious patients, always perform a secondary assessment of the entire body or head-to-toe examination. So physical examination. Examine the head, scalp, and face. Examine the neck closely. Make sure there's no JVD, there's no tracheal deviation. Also, when you're checking the head, you're checking the ears. You're checking if there's any fluid coming out. You're checking the pupils. You're checking the nose. You're opening up the mouth, seeing if there's any loose or broken teeth. How did they bite their tongue if they have a seizure? Is there any fluid in there that you might have to suction out? And then assess the chest and abdomen. Is it equal chest rise and fall? Okay, and then palpate the legs and arms. Examine the patient's back. Do you see any injuries? You're palpating the spine as well. So vital signs. Assess the pulse for rate, quality, and regularity. Identify the rate, quality, and regularity of the respirations. Obtain initial blood pressure. Consider obtaining a blood glucose level and a pulse oximetry reading. So every time you're taking vital signs, the minimum 3 vital signs you need to give is blood pressure, your respiratory rate, and a pulse. Yes, it's good to have a blood glucose level and a pulse oximetry reading because that'll help you in your assessment too. It'll help you rule things out. So reassessment, performed once the assessment and treatment have been completed, begins and continues throughout transport. Consider the need for ALS backup. Reassess interventions. Document any developed changes. So after your initial assessment and your treatment, you continue to reassess your patient. You want to see if they're getting better. You want to see if they're getting worse. You want to see if there's something else you need to intervene with. You want to see if there's something else that you miss, especially in a serious call when there's a lot of stuff going on. There's a lot of people there, and everyone's yelling and screaming and talking. It's important to reassess. And then also you want to document any changes in the patient. So management, transport, and destination. Most medical emergencies require a level of treatment beyond that available in the pre-hospital setting. May require advanced testing available in a hospital. May be beyond the scope of the EMT to administer medications to a patient. EMTs can use the AED. So in patients with a stroke, patients with a STEMI, patients with traumatic injuries, the best thing we could do for a patient is to get them to a hospital as fast as we can because they're probably going to need a surgeon. They're going to need a specialist. So this is why it's important to be on scene for a medical for no less than 15 minutes. And especially with the trauma, no less than 10 minutes, the golden hour, from the time of injury to the time that they get to the ED. And also EMTs, you're limited in what medications you can give to help the patient with whatever condition they're dealing with. So they may need ALS, or they may need a doctor. Okay, so scene time may be longer for medical patients than for trauma patients. So medical patients, like I said, you give them about 15 minutes. You want to learn everything there is about that person in a span of 15 minutes. You want to ask all your questions. You want to make sure you're not missing anything. It seems like a long time, 15 minutes to be on scene, but it goes by very quickly. Trauma patients, you're thinking about 10 minutes. You want to get them on the gurney. You want to start going to the hospital as fast as you can. So gather as much information as possible and to transmit to the ED. Sometimes you're given very limited information, but you want to try and gather as much as you can. Critical patients always need rapid transport, very old or very young. So type of transport. So life-threatening conditions, lights and sirens. So this would be a code 3 transport. Non-life-threatening condition, consider non-emergency transport. So this would be a code 2. Modes of transport ultimately come in one of two categories, ground or air. So for our county, any transport that's going to take longer than about an hour, we could call for a helicopter to meet us if it's a serious call. If it's not a serious call, we can transport them by ambulance. We don't get very many calls that are longer than an hour to the hospital. But if we're up in the mountains or up in a place where it's going to take us a while to get down or to the hospital, we call for a helicopter. Or if it's a pediatric trauma, we call for a helicopter because the nearest pediatric trauma is going to be Santa Clara Valley Med. That's a little bit of a drive for us depending on where we are in the county. So ground transport EMS units are generally staffed by EMTs and paramedics. So this also depends on what county you guys work in. This county we run EMT and medic. So 2 people to a rig. Some counties run dual medics. Santa Cruz used to do dual medics. They switched it over within the past 10 months or so, past year. So now it's EMT medic. Sometimes you're only going to get 2 EMTs on an ambulance. Just depends on where you work and which county you're in. Air transport EMS units are generally staffed by critical care transport professionals and paramedics. So most of the time, you're going to get, for a helicopter, at least 1 nurse. So it might be 1 nurse and 1 paramedic. Or it might be 2 nurses. And then you also have a pilot as well. Important thing to remember too is these helicopters have a weight limit. So anything over 250 pounds, you're going to have to go by ground. Destination selection. Generally, the closest hospital should be your destination. At times, the patient will benefit from going to another hospital capable of handling his or her particular condition. We very rarely bypass hospitals depending on the nature of the call. The only time you really bypass hospitals is if a patient wants to go to a different hospital and their condition doesn't warrant a specialty center. But if their condition does warrant a specialty center, then we might bypass a couple hospitals. So if we're in Monterey and we have a traumatic injury, we're going to drive all the way to Natividad and Salinas. So we're going to bypass CHOMP, and then we're going to also bypass SVMH. So infectious diseases. General assessment principles. Approach like any other medical patient. Perform scene size up. Take standard precautions and complete primary assessment. Gather patient history using OPQRST to elaborate on the patient's chief complaint. Obtain a sample history and a set of baseline vital signs. So you're going to get signs and symptoms from the patient. You're going to get allergies, meds, past history, last time they ate or drank, and then events leading up to the complaint. Ask whether the patient has recently traveled or has come in contact with someone who has traveled. So this is for people who have traveled out of the country. So things like Ebola are things we want to be aware of. General management principles. Focus on any life-threatening conditions identified in the primary assessment. Be empathetic. Place the patient in a position of comfort on the stretcher and keep them warm. Use standard precautions. Don't judge anybody on what they tell you, what medical conditions they have. So epidemic and pandemic considerations. So epidemic, new cases of a disease in a human population substantially exceed what is expected. A pandemic, a disease outbreak that occurs on a global scale. So if a disease happens in one country, but it doesn't spread to other countries, then that wouldn't be considered a pandemic. Okay, so influenza, or the flu, an animal respiratory disease that has mutated to infect humans. Those with chronic medical conditions, compromised immune systems, and the very young and the very old are most susceptible to complications of influenza. So this is another thing why it's important for people to get their flu shots, especially those that work in the medical field or those that work in the hospitals. Because some patients do have compromised immune systems. Transmitted by direct contact with nasal secretions and aerosolized droplets from coughing and sneezing by infected people. So remember, the number one way to transmit disease is through hand contact. That's why it's important to wash your hands. Every time you go into a patient's room, once you guys go into the hospital and do your rounds, you'll see the doctors, you'll see the nurse, wash their hands as soon as they walk in, and as soon as they walk out, they're going to wash their hands again. So H1N1, initially identified as a swine flu, present for years in animals, initially identified in 2009, caused many deaths, increased awareness of routes of transmission. For diseases that can be passed by the respiratory route, always wear PPE, gloves, eye protection, and HEPA respirator. Place a surgical mask on patients with suspected or confirmed respiratory disease. So a patient tells you that they're sick or they have the flu, it's probably a good idea to throw a mask on them. Or especially when you have somebody who says they have TB, you're going to throw a mask on them. You're going to turn on the air conditioning. You're going to turn on the air vent or the exhaust vent in the back so you don't catch TB. Annual influenza immunization is important for EMS personnel to protect providers and patients. So every year, once it starts to become flu season, we're required to get a flu shot. If we don't get a flu shot, we have to wear a mask for about 4 or 5 months. Anytime we're on scene with the patient or anytime we're in a hospital, we have to wear a mask. So Herpes Simplex, common virus strain carried by humans. Of individuals carrying the virus, 80% are asymptomatic. So what does asymptomatic mean? So A is going to be without. So without symptoms. Symptomatic infections cause vesicles that appear on the lips or genitals. Can cause more serious illnesses in susceptible patients. Primary mode of infection is through close personal contact. HIV infection. EMTs face a risk of exposure. No vaccine yet exists. AIDS can still be fatal. However, with treatment, patients can expect a near normal lifespan. Not easily transmitted in the work setting. Your risk of infection is limited to exposure to an infected patient's blood or body fluids. So this is why it's very important when we're dealing with IVs or lancets, the things we use to poke fingers with to get a blood sugar, is we want to make sure that we're Taking proper body precautions, PPE. We always throw away our sharps in the sharps container. And also your body fluids. You want to make sure that we clean in the gurney after every call. We want to make sure it's clean for you as well as for the next person. We don't want to transmit any diseases to anybody, especially not our next patient. Many patients with HIV show no symptoms. Always wear the proper type of gloves. Take great care in handling and disposing of needles. Cover any open wounds. So if you get a cut outside of work, it's important that you throw a Band-Aid on and you make sure you keep it covered anytime you're at work, because this is how diseases get spread, especially through open wounds. It's a lot easier to get infected. If you think a patient's blood or secretions may have entered your system, seek medical advice and notify your infectious disease officer. So anytime you think you've been exposed to something, we have to fill out a patient exposure report. We have to notify our supervisor. We have to go get tested and possibly get on some medications for the time being. And also have the patient tested for any diseases to make sure that they don't transmit anything to us. Hepatitis, inflammation and often infection of the liver. Early signs: loss of appetite, vomiting, fever, fatigue, sore throat, cough, muscle and joint pain. So later signs: jaundice, so it's yellowing of the skin or yellowing in the eyes. So right upper quadrant abdominal pain. So how would you write that in your PCR? What would be the abbreviations for that? So you could do RUQ space ABD and then PN. So right upper quadrant abdominal pain. Toxin-induced hepatitis, not contagious. There's no sure way to tell which hepatitis patients excuse me. There's no sure way to tell which hepatitis patients are contagious. So this is why we treat every patient as possibly contagious, even if they don't have anything. Vaccination with hepatitis B vaccine is highly recommended for EMTs. So these are all your different types of hepatitis, and then the route of infection. So hepatitis A is going to be fecal oral infected food or drink. So this is if you go to a restaurant and the cook in the back doesn't wash their hands and it gets on their food and you eat it, you could possibly get infected with hepatitis A. Hepatitis B, blood, sexual contact, saliva, urine, breast milk. And then Hep C, blood, sexual contact. Hepatitis D, blood, sexual contact. So the only way you get actually hepatitis D is if you already have hepatitis B. So meningitis, inflammation in the meningeal coverings of the brain and spinal cord. Signs and symptoms include fever, headaches, stiff neck, altered mental status. Most forms of meningitis are not contagious. Meningococcal meningitis is highly contagious. Take standard precautions. Meningitis can be treated at the ED with antibiotics. After treating a meningitis patient, contact your employer health representative. So before you guys go to college, you guys would have to get a vaccine for it. I think most colleges are asking for it now. I had to get a meningitis shot or meningitis vaccine before I went to college because you guys are in close quarters and it's a lot easier to spread. So tuberculosis, another one that comes in close quarters. So if you go to jail and you pick somebody up, there's a possibility that they have TB as well because they're not sanitary conditions. Diseases spread a lot easier. Things aren't getting clean. So many infected patients are well most of the time. Chronic mycobacterial disease that usually strikes the lungs. Patients who pose the highest risk almost always have a cough. Consider respiratory tuberculosis to be the only contagious form. N95 or HEPA mask are required to stop droplet nuclei. So if you suspect somebody who has TB, or somebody tells you that they have TB, go ahead and throw on an N95 and throw an N95 on your patient as well. Infectious agents can take hold in some patients much more easily because of reduced defenses. So some of those patient populations are going to be elderly patients and people who are immunosuppressed from chronic illnesses, cancer treatment, or organ transplants. Absolute protection from the tuberculosis does not exist. 1/3 of the world's population is infected with tuberculosis. The vaccine is rarely used in the United States. Mechanism of transmission is not efficient. Have tuberculin skin tests regularly. Preventive therapy is almost 100% effective. So another thing you guys had to get tested for was TB. They give you a shot in your arm or your skin, and they look at it after a couple of days to make sure you're not infected. If you've been exposed to it before, you might have to get a chest x-ray because the skin test is not going to work. So whooping cough, also called pertussis, mostly affects children younger than 6 years. Symptoms include fever and a whoop sound that occurs when inhaling after a coughing attack. The best way to prevent exposure is to be vaccinated. Place a mask on the patient and yourself. So MRSA. MRSA is a bacterium that causes infections, resistant to many antibiotics. In healthcare settings, MRSA is transmitted from patient to patient by healthcare providers' unwashed hands. So remember what we talked about earlier. Any room you go into, you're going to wash your hands before you go in, and then you're going to wash your hands after you leave. This is a good way to prevent transmission of diseases in the healthcare setting. Factors that increase the risk of MRSA: antibiotic therapy, prolonged hospital stays, a stay in intensive care burn unit, exposure to an infected patient. MRSA results in soft tissue infections, localized skin abscesses, and sepsis in older patients. Global health issues. So Middle East respiratory syndrome, coronavirus. First human case discovered in 2012 in Saudi Arabia. Common patient symptoms include high fever, cough, muscle aches, vomiting, diarrhea, and in some cases renal failure. So what does renal mean? Renal is going to be kidneys, respiratory failure, and death. No cures or vaccines for this virus at present. Ebola. Talked about this earlier. 2014 outbreak of the Ebola virus in West Africa. Incubation period 6 to 12 days after exposure. Symptoms may not appear for as long as 21 days after infection. Symptoms include watery diet, vomiting, fever, body aches, and bleeding. Fatality rate can be as high as 70% if treatment in the ICU is not initiated promptly. So this is why they always ask, have you been out of the country recently? If you're complaining of any of these symptoms, they want to know if you've been to West Africa or any other countries that possibly you could have been exposed to something else. Travel medicine. You must be aware of travel-acquired infections when assessing a patient who is recently outside of the United States. Patients can present with a variety of symptoms. When you encounter an ill patient with a recent travel history, place a mask on the patient and gather as much information as possible. So before you go out of the country, you go talk to your doctor and you let him know which country you're going to. And he'll give you a list of medications or vaccines that you need to take. You might either get vaccinated right before, or there might be some medications that you have to start taking once you get there. Important questions to ask include, where did you recently travel? Did you receive any vaccinations before your trip? Were you exposed to any infectious diseases? Is there anyone else in your travel party who's sick? What types of foods did you eat? What was your source of drinking water? And so you want to see if there's anybody else that may have the same symptoms as you that you were traveling with. And then what types of foods did you eat? And then what was your source of drinking water? Most of the time they're going to tell you drink bottled water. Conclusion. Assessment and treatment of medical patients can be challenging and interesting because of the nature of medical conditions. The condition of a medical patient may not be as apparent as in a trauma patient, and treatment may not be as straightforward. So medical patients can be some of the most challenging calls because patients don't want to be forthcoming with what's going on. They don't want to tell you their medical history. They don't want to tell you what medications they might take because they either might be afraid or they don't want to tell them in front of family members or friends. So this is why it's important to continue to ask, continue to rule everything out. Make sure you get a full set of vital signs. And also, patients sometimes have more than one isolated problem. So review, a seizure patient is having what kind of medical emergency? So C, neurologic emergencies involve the brain and may be caused by a seizure, stroke, or fainting, syncope. So if an injury distracts an EMT from assessing a more serious underlying illness the EMT has suffered from, so what's tunnel vision? What does index of suspicion mean? Index of suspicion is going to be, what do you think might be wrong with that patient regarding what their injury is, or what they said caused their injury? So A it's going to be tunnel vision. As an EMT, you should use the dispatch information to guide your initial response, but do not get locked into a preconceived idea of the patient's condition strictly from what the dispatcher tells you. Tunnel vision occurs when you become focused on one aspect of the patient's condition and exclude all others, which may cause you to miss an important injury or illness. So it's very important for you guys to understand that when you guys get a call and they tell you what it is, you don't get locked into a certain assessment or a certain route that you want to go down, because that patient might not have that specific complaint when it comes in. And you might miss something if you don't cover all your bases. So index of suspicion. The index of suspicion is your awareness and concern for potentially serious and underlying and unseen injuries or illness. Okay. If a frequent flyer calls 911 because of a suspected head injury, you should never So every patient you want to make sure that you take serious. Pretend like you don't know the patient. Do a full assessment. Make sure you don't miss anything. So C, you are obligated as a medical professional to refrain from labeling patients and displaying personal biases. Never assume that you know what the problem is. Even when you're treating a patient who frequently calls for EMS, this attitude could result in missing a serious condition. Having this type of attitude out in the field could be detrimental to your patient. It could have serious consequences. It could also have serious consequences for you if you miss something. Your license could get under review. If your medical patient is not in critical condition, how long should you spend on the scene? So for non-critical patients, you could spend a little bit more time to figure out what the problem is and how you could treat it. So D, in many cases, the time on scene may be longer for medical patients than for trauma patients. the patient is not in critical condition, you should gather as much information as possible from the scene so that you can transmit that information to the physician at the emergency department. So 30 minutes, I'd probably say that's your max. I wouldn't spend longer than 30 minutes on scene for a patient, even a non-critical one. 2 hours, that's way too long. If you don't get a lot of information within about a 30 minute period, I would go ahead and leave the scene. Your patient is having respiratory difficulty and is not responding to your treatment. What is the best method of transport? So if patient's having issues breathing and they're not responding to your treatment, EMTs, you guys are limited on what you could do for a patient. So B, patients with high respiratory difficulty generally require high priority transport, especially if they do not respond to your initial treatment. If a life-threatening condition exists, transportation should include lights and sirens. In this case, it is appropriate to select the closest hospital with an emergency department as your destination. So I would go ahead and bump it up to code 3. There's very little you guys could do, especially with patients with respiratory difficulty. If they're not responding to your initial treatment, go ahead and get to the hospital a little quicker. Have them seen by a physician. When assessing a patient with an infectious disease, what is the first action you should perform? What is the first thing you guys do on every single call? A, the assessment of a patient suspected to have an infectious disease should be approached much like any other medical patient. First, the scene must be sized up and standard precautions taken. Always show respect for the feelings of the patient, family members, and others at the scene. A patient believes he has hepatitis and is now exhibiting signs of cirrhosis of the liver. He most likely has So if you guys go back to that table, they give you signs and symptoms of each hepatitis. So C, cirrhosis of the liver develops in 50% of patients with chronic hepatitis C. Patient is complaining of fever, headache, stiffness of the neck, and red blotches on his skin. He most likely has So D, patients with meningitis will have signs and symptoms such as a fever, headache, stiff neck, and altered mental status. Patients with meningococcal meningitis often have red blotches on their skin. However, many patients with forms of meningitis are not contagious, also have red blotches. What should you do if your exposed patient is found to have pulmonary tuberculosis? So remember, if I get exposed to someone on a call, there's a few steps I have to take. I have to inform the hospital. I have to inform my supervisor how there's some paperwork I got to fill out. And also I have to go get tested and possibly start medication treatment. So B, if you're exposed to a patient who's found to have pulmonary tuberculosis, you'll be given a TB skin test. This simple skin test determines whether a person has been infected with tuberculosis. So all the following are factors that increase the risk for developing MRSA except prolonged hospital stays. That's a risk for developing MRSA. Exposure to an infected patient, that's definitely a risk. Antibiotic therapy, that's also a risk. So it's going to be D. Factors that increase the risk for developing MRSA include antibiotic therapy, prolonged hospital stays, a stay in intensive care or a burn unit, and exposure to an infected patient. Close contact with wild birds is a factor that may increase the risk of acquiring avian flu or bird flu.